Market failure refers to a situation that is characterized by an ineffective distribution of commodities and services in a free market. Nevertheless, when there is a failure in the market, there is something that disrupts this equilibrium. In this video, there are 3 public goods provided by the government of Malaysia that lead to market failure, which are infrastructure, healthcare, and national defense. There are several challenges does the existence of these public goods present to the market. Infrastructure projects are costly and capital-intensive, but they're essential for economic growth. To ensure safe, available water, river raw water quality must be regulated and maintained. Water quality degradation lowers the value of resources for multiple parties. Unfortunately, Malaysia is at risk. The 2015 to 2050 Water Resources Survey projects a 221 to 246 million cubic meter water deficit in Perlis, Kedah, and Penang. Poor sewage management in flash flood-prone zones is another countrywide issue. Night market hawkers who litter can clog sewers. Besides, good health is life's greatest asset. Younger doctors head state health organizations with trained staff, while elder doctors lead private offices with less skilled staff. Private centers outnumbered state ones by 6.3. Unfortunately, remote, high mountain, or densely wooded areas are often ignored. These areas are harder for medical staff and supplies to reach than city hospitals. For example, in emergencies, IJN, Institute Jantung Negara, provides costly Kota Kinabalu, Sabah heart and cardiosurgery services on a weekly shift of experts. Malaysia's liberty, physical union, and economic growth are defended by the Ministry of Defence's National Defence Policy. When addressing project delays, the third step, job execution, is often discussed. Malaysian MOD projects are no exception. MOD programs often experience delays, according to Malaysia's Auditor General. Transparency International's TI Defense and Security Program's first score found that 70% of states cannot avoid waste and security risks. Military misconduct costs citizens, forces, companies, and governments. Risky, divisive, and costly. General procurement law controls the risk of deceit in defense and security buying, but there is little public evidence that it is observed. There are several steps the government of Malaysia can take to improve access to public goods. Infrastructure, healthcare, and national defense access can be improved. First, addressing economic disparity can help the government better access to public goods. Unequal urbanization may endanger healthy growth. Urbanization requires infrastructure to support a variety of urban pursuits. However, facilities in resource-poor areas may allow them to take advantage of new output opportunities, reducing inequity. Better transit facilities can boost chances and market access for lower-income groups. Telecommunications infrastructure can reduce inequity by tying to key economic activity and giving fast access to better opportunities. On the other hand, the government can improve access to public goods by increasing funding. Finance enables the more effective allocation of capital resources. This situation is the same regarding the finance of public goods. Healthcare investment saves lives and boosts the economy. Illness hurts human capital, career prospects, and productivity. For instance, the governments of Brazil, Costa Rica, and Thailand have implemented social security and health insurance schemes for the entire population. High healthcare costs and poor outcomes jeopardize our economy's long-term health. Fortunately, we can improve our healthcare system to deliver better treatment at lower costs. Government transparency matters. Transparency increases government responsibility and tells the people. To avoid useless, ineffectual, and dishonest spending, military planning and buying must be open and responsible. PEM principles include diligence, discipline, truth, flexibility, reliability, contestability, honesty, information, openness, and accountability. Defense is difficult because national security demands high spending and secret. Eliminating middlemen, improving payment processes, and increasing price clarity are crucial. There are several steps the government of Malaysia can take to improve the effectiveness and efficiency of public goods. One approach is to broaden investment in infrastructure projects, particularly those focused on transportation and communication. One strategy to improve is prioritizing infrastructure investments with high economic and social returns. Malaysia can also prioritize investments in sustainable forms of transportation, such as public transportation and non-motorized transportation, to boost mobility and accessibility while lowering carbon emissions and traffic congestion. Malaysia has experienced tremendous investment in its telecommunication infrastructure, particularly in mobile and broadband networks. Malaysia's government has set lofty goals for the country's digital transformation, including 100% internet coverage and 5G connection by 2025. Besides, the government must increase healthcare spending. The government can boost healthcare spending to improve the quality of healthcare services. Then, the government also must enhance healthcare infrastructure, such as the construction of new hospitals and clinics, the renovation of existing facilities, and the provision of innovative medical equipment. Promote preventive healthcare aims to lessen a load of diseases on the healthcare system through the implementation of health education programs, the promotion of healthy lifestyle practices, and the provision of screening and vaccination services. As a result, it helps reduce the occurrence of certain diseases while also lowering healthcare expenses. Moreover, increasing the military budget tends to have better GFP rankings, indicating stronger military might. Expanding local defense spending would provide more value in the form of stronger national security and fewer disruptions to trade and business. Besides, investing in modern technology and equipment, such as investing in cutting-edge technology and equipment, could assist the military to improve its capabilities. For example, can use drones to acquire aerial footage and photos of enemy bases and territory. Finally, the government should also invest in cutting-edge military technologies like unmanned aerial vehicles, UAVs, precision-guided bombs, and cybersecurity to modernize its military capabilities, increase deterrence, and protect its territory. Privatization of public goods would increase efficiency and decrease market failure. Before privatization, Malaysia's infrastructure market was defined as a lack of investment in new infrastructure, a lack of competition, and ineffective service delivery. For instance, Telekom Malaysia, which resulted in high costs and a dearth of innovation, and Tenaga Nasional Berhad experienced frequent power outages and a dearth of investment in new infrastructure. The potential to invest in infrastructure projects, more competition, and improved service delivery efficiency, including roads, airports, and water supplies, has increased as a result of privatization. In addition, the government has been able to alleviate its financial burden to make it possible for the government to allocate funds to other development sectors like healthcare and education. There are some issues suffered by Malaysia's healthcare system, such as an insufficient budget, restricted access to healthcare services, unequal resource distribution, and limited use of technology before implementing privatization. Privatization sought to alleviate these inefficiencies through increasing private sector involvement. As a result, there is more competition and the level of treatment for patients has improved. Many private hospitals in Malaysia provide upper medical care at reasonable prices, making it a popular destination for medical tourists, causing better patient care and more investment in private healthcare facilities. There is currently no initiative or plan to privatize the military forces in Malaysia. There have been some initiatives to involve the private sector to support the national military effort. For instance, the Malaysian Defence Ministry introduced the Industry Collaboration Program (ICP), collaborating with international firms to develop and produce defence technology in 2017. In assumption, private businesses are typically more flexible and market-oriented in enhanced efficiency and cost savings.